The pandemic has a silver lining for many of us seeking treatment.
You don't have to rely on in-person doctor's visits as much or leaving the house when you're sick, for example, because testing can now be done at home. But this isn't the only benefit. Wink News Health and Medical reporter Veronica Marshall tells us how this could save you money.
For Caitlin Donovan, it seems like her kids always get sick Friday afternoon.
You then have to go to either urgent care or an ER because your primary care provider is closed. And that costs more money on your copay, and it costs the system more money because they charge more.
Even if symptoms show up during office hours, you're still looking at taking time off of work, which can mean lost income. But there is one thing that could help ease the burden: at-home testing.
If I could have a simple at-home strep test, I know it's strep. I could maybe show the provider that it's strep, and then they can just prescribe me an antibiotic over the phone. That would be a lot simpler.
Simpler and cheaper, says Harvard Dr. Michael Mina.
The average markup is 40-fold of a test. That's criminal. It's bankrupting us as an economy. And so I would like to see that change.
It's almost a pure profit business, and it's become a very, very lucrative part of the business for most healthcare providers.
And experts say one silver lining to the pandemic is that we're moving closer to that change.
They've had to change the payment model for the COVID testing, right? So where you can get reimbursed from your insurance company. So it's possible. There's nothing stopping it from happening except for the system.
This little device has the power to tell some person in the future if their kid has flu or whatever. It can look for all sorts of things.
A little device saving families time and money. Veronica Marshall, Wink News Now.
Now, some insurance companies are already using at-home testing models. United Healthcare says its new Well at Home program is for people experiencing flu-like symptoms. The program sends patients Tamiflu, a COVID-19 test, a thermometer, and a free telemedicine appointment. So far, 400,000 people have signed up for the program.